Thank you. I'm Lisa Edmonston, and I'm chair of the board of the Cancer Support Team Board of Directors. And on behalf of our board, our Luncheon Planning Committee, and the entire CST staff, I'd like to welcome you to the 20th Annual Gayle K. Lee Health Awareness Luncheon. Thank you so much for joining us today. To begin the afternoon, Patty Vaughn, one of our amazing nurses, whom many of you know, will read the invocation. Patty?
Thank you. On this day, filled with the pursuit of knowledge and the joy of companionship, we bless this food at our table. We are grateful for all of you gathered here, cancer survivors, friends, families, caregivers, and healthcare professionals. We are reminded that in numbers, there is strength, there is courage, there is hope, there is caring, and someday there'll be a cure. Amen.
Cancer Support Team was founded in 1978 by Dr. Arnold Wald, a radiation oncologist, and Gayle Lee, a nurse and patient advocate. We're the only Westchester-based home care program focusing solely on individuals and families affected by cancer that offers its services at no cost and without regard to insurance coverage. And I can't believe I'm reading this because I know that by heart, but our mission is to improve the quality of life for individuals and families affected by cancer at any stage of the disease. We do so by providing in-home nursing care and education, patient and family counseling, and case management, as well as transportation to treatment appointments through our wonderful volunteer drivers, one of whom is our Volunteer of the Year this year, and small financial assistance grants. CST is truly a unique organization, and we're thrilled to be celebrating our 40th anniversary this year. As all of our services are offered at no cost, it is only through your generosity that we are able to provide them. So thank all of you for being here today and for your support, which allows us to continue the amazing work our team does every day. It takes a village to make for a successful event, and I want to make sure to thank the many people who have made today's luncheon possible. First, our heartfelt thanks go out to our honorary co-chair, Mary Jane Aragoni. Unfortunately, she could not join us today, but her unending support of the luncheon and Cancer Support Team is deeply appreciated. I also want to recognize our silver sponsor, New York Presbyterian Lawrence Hospital, for their support. Next, to our luncheon co-chairs, Val Allen, Jean Meyerowitz, and Alice Latondo, and each and every member of our luncheon planning committee who dedicated countless hours to make this event a success. Finally, we're so fortunate to have special relationships with our amazing honorary committee, all cancer survivors, from whom we draw our inspiration to continue our work and to organize such powerful educational programs such as this luncheon. You are instrumental in keeping us grounded and focused. Would Val, Jean, our luncheon planning committee, and honorary committee members please stand so we may recognize you with a big round of applause. It would be remiss of me not to recognize the work of the Cancer Support Team staff and volunteers, not only for helping with this very important event, but for what you do each and every day to support the people living with cancer and loved ones that we serve. I'm so proud to be Executive Director of Cancer Support Team and an amazing organization. Thank you all so very much. Our raffle sellers will be coming around the tables later on, and during lunch you have booklets on your tables if you didn't get a chance to get tickets in the back. We do also take credit cards, so if you are looking to buy raffle tickets and don't have a check or cash, there's a table in the back that has that capability. So we'll be back in a little while to present the Volunteer of the Year Award, draw our raffles, and most importantly, introduce Dr. Chung and hear her speak about what's new in genetic testing and cancer. Thank you.
We are about to present the Volunteer of the Year Award, excuse me. Our Volunteer of the Year Award was created to honor the memory of Ruth Lowy, a volunteer driver for Cancer Support Team for 18 years and a longtime member of the Luncheon Planning Committee. She was also a member of Team CST, our team for Swim Across America. Ruth was a true friend of Cancer Support Team and to so many in this room. I am privileged to present this year's Volunteer of the Year Award to Pete Goldsmith. Pete became involved with CST because his wife was a patient and attended Patty Vaughan's ovarian cancer support group. Pete wanted to give back to the community and has been a volunteer driver for us since 2011. Pete also volunteers for New Haven Reads and serves on its board. In addition to his volunteer activities, he enjoys spending time with his children and 4 grandchildren. Thank you, Pete, for all you do for Cancer Support Team. Please accept this small token as a token of our sincere appreciation. And those of you, when you leave, you can look at our Volunteer of the Year Award plaque, which is in our office, but today is in the front with Pete's name on it already. Thank you again.
Hi all. We're going to continue with our program now. If I can ask our basket raffle sellers or raffle basket sellers to please do one last quick check with your tables and then give any of your tickets and your baskets to Monica so that we can pull the raffle tickets. While we're waiting for that, I'm going to move on and say that I'm certain you've all noticed the beautiful flower centerpieces in your tables. Those are designed by one of our committee members who did not be here today, Stephanie Picone, and Flowers by Stephanie. And we have a wonderful tradition of gifting those centerpieces to the person at the table whose birthday is the closest to our speakers. And I have to make sure I get this right because coincidentally enough, Wendy Chung, our speaker this year's birthday, is one day before Wendy Harpham, our speaker's last year's birthday. So I hope I have the right birthday, but October 16th? Okay, so if your birthday is closest to October 16th, please take the flowers at your table home and enjoy them. Okay. Moving on. Inside your programs that were on your chair, I'm sorry if I'm too loud. Oh, we're figuring out who got the flowers. So inside your programs are evaluations. Those are very important to us as they help give us important feedback on what you liked or didn't like about the luncheon, suggestions for people to add to the committee, the honorary committee, and also for if you have speaker suggestions or whatnot, or friends you'd like to have on the mailing list. So please be sure to fill those out. You can either leave them on the table. There will be a basket at the back of the room on the resource table, which is over back here, or one of our staff members will have a basket as you leave as well. If you haven't had a chance to check out the resource table, please do so. There's an example of some of the information about Cancer Support Team, but also there's a chemo comfort kit, which is something we give to our patients that's very useful. So it's a very interesting resource.
Thank you, everybody, for coming. This is probably one of the best things I do all year, so I'm happy to be here and glad to see so many familiar faces back again. I have the privilege of announcing Dr. Chung, and I have to say I had to work really hard to cull down some of her resume. I told her that I just cut out the things I couldn't pronounce. But there's a lot in there, so do read the bio, and you can find her on Wikipedia and a lot of other places too. But we at Cancer Support are thrilled and honored to have Dr. Wendy Chung, MD, PhD, here to speak with us today. As a clinical and molecular geneticist and physician, she currently directs the clinical genetics program at Columbia University and serves as the Kennedy Family Professor of Pediatrics. Dr. Chung received her BA in Biochemistry and Economics from Cornell University, her MD from Cornell University Medical College, and her PhD in Genetics from the Rockefeller University. She directs NIH-funded research programs in human genetics of breast cancer, pulmonary hypertension, autism, neurodevelopmental disorders, and birth defects. Currently, she leads the Precision Medicine Resource in the Irving Institute at Columbia University. As recipient of numerous awards, Dr. Chung is renowned for her teaching and mentoring and has received Columbia University's highest teaching award, the Presidential Award for Outstanding Teaching. And we just found out on November 1st, Dr. Chung is about to receive the Academy Medal for Distinguished Contributions in Biomedical Science from the New York Academy of Medicine. Congratulations. Try to say that 3 times fast, right? Dr. Chung is well known for her TED Talks with millions of views, and today will speak with us on what's new in genetic testing for cancer. Without further ado, I'd like to introduce Dr. Wendy Chung.
Thank you so much for having me here today, and thanks to the organizers for inviting me. So how many people here either have had cancer themselves or have had someone in their family with cancer? Okay, I was going to say, maybe I should have gone the other way around. Is there anyone who hasn't themselves either had cancer or family member? Okay, so this is for you. Okay, so everyone needs to listen up now. So my goal in life is actually to get rid of cancer, to make it to the point where we don't have to worry about this, right? I would much rather also prevent cancer than have to treat cancer. And so part of what we try and do is think about what are the health threats that people have and how can we get in front of them? How can we get ahead of them? So whether it's for ourselves, whether it's for our brothers or sister, whether it's for our children or our grandchildren, try and use genetic information in a way to be able to prevent that. We also, though, realize that we're not quite there yet, and so we also have the goal for individuals who are diagnosed with cancer, making sure they get the right type of treatment, making sure they get the right type of treatment for their type of cancer in a customized way or in a precision way to try and minimize what we do to them in terms of the toxicities of our treatment and maximize what we do in terms of their therapies. And so within this, I know it's a little bit complicated, but we actually look at the genetic information from the tumor, because that tells us what we're treating, and we have to be able to figure that out. But we also look at the genetic information of the person to be able to understand for them what's unique about their particular body and the way it's responding either to cancer treatment or potentially cancers in the future. And so even for individuals who have had cancer, once is one time too many. But what I worry about is that some of those individuals might actually be at risk to have another cancer in the future. And for some of them, that other cancer might even be more deadly, more fatal, or more concerning. And so anyone who's had cancer in particular, I want you to listen very carefully. The reason I say listen carefully is that things are changing for my field, and they're changing really, really fast. And so for those of you who have either heard about genetic testing, or maybe even you or someone in your family had genetic testing in the past, if the past was more than 3 or 4 years ago, it's very old, and there may actually be reasons to get some updates or to think about what's new. So how many people know about Angelina Jolie? Who's heard about Angelina Jolie? Okay. So besides Angelina Jolie being extremely successful as an actress, how many people know about Angelina Jolie's family history of cancer? Right. So I actually have great admiration for Angelina because I think she did a remarkable thing in terms of being able to increase what I call the genomic literacy or understanding about people in the public. So I think many of you know already that in Angelina Jolie's family, her mother, her grandmother, her aunt, all 3 of them either had breast or ovarian cancer and died from those conditions. And she realized that. She realized that she did not want to follow her mother's footsteps in that particular case. She found out that she was at risk. She had the BRCA mutation. She found out that she was at risk. And as many of you know, took some, I think, very aggressive, good steps to keep herself healthy. Actually had bilateral mastectomies and eventually bilaterally taking out her ovaries and her tubes. And in a good way. She's still gorgeous, she's still smart, and most of all, she's healthy and she's alive. And she has taken that, like I said, because she had the ability to know her family history and know what steps she could take. So within this, many of you have heard about BRCA1 or BRCA2, or some people call them BRCA1 and BRCA2. I don't know if you can remember this. You probably don't really think about this too much, but as a geneticist, one of the things I was concerned about for many years is that that testing was available, but it was really expensive. And by really expensive, if you can think back to this, 10 years ago, how much do you think that test cost? If you were paying out of pocket for that test, what do you think? Okay, so I heard a bunch of different numbers, and I heard close to the right numbers here. It was close to a $4,000 test for having the full test in terms of doing this. By comparison, and I'll explain why in a second, by comparison, that same test, how much do you think that costs today? Okay, so I heard one little low ball in there, but but I did hear a lot of the right numbers, depending on how sophisticated you are as a shopper in terms of doing this, and depending on exactly where your family comes from, can be in the neighborhood of anywhere from about $99 to about $250. So tremendously less expensive. And the reason it was much less expensive was what I call my Don Quixote experiment. I really had no idea that this would work. I thought I was really just sort of battling windmills. But to make a long story short, I was very upset that many of my patients couldn't get access to that testing 10 years ago because $4,000 was a lot of money for people. And so I said, you know what? The reason why it's $4,000 is because there were patents on genes. There were these things in terms of being able to say, I own this gene, and if you want to get tested and know your information for this gene, you have to pay me, and you can only pay me. And you may or may not know this, but I was, besides being a biochemistry major as an undergraduate, I was also an economics major. And I realized that the reason for that was because there was a monopoly, right? There was one laboratory performing testing, and so they could set the price, and they set the price very high, and that was why we were in that market situation. So I started whispering to people in the government. I said, this isn't really fair. And they said, well, you know what? We're going to let you have some congressional testimony on that.